everyone, and welcome to our Monday Minute. Today, I want to share some thoughts regarding the home health proposed rule for 2026 and hopefully give you a few points of guidance in commenting on that proposed rule. It has been very exciting to see many of you at your state association meetings over the spring and summer and at the National Financial Summit that we are just coming home from. It is very concerning. The implementation of this proposed rule, were it to become final, would be devastating for home health agencies throughout the country, regardless of the size of the organization, for sure. I want to encourage you, most importantly today, to comment on this proposed rule with your concerns. They expect the state associations to respond. They expect the National Association to respond, but they need to hear from you, individual agencies, as to exactly how these proposed changes are going to impact your organization, especially when it comes to patient access to care. We have heard of home health agencies that have had to cut the distance that they can have their clinicians travel to see a patient, therefore leaving some of those patients in the outer areas without care. Medicare needs to understand how these cuts are going to restrict those patients or any patient access to care. It's vitally important they understand that. In addition, there is one positive thing that you should comment on, and that is the face-to-face encounter proposed change. They are proposing for the face-to-face encounter to allow any allowable practitioner to provide a face-to-face encounter note that meets the requirements, of course, supporting home health and within the time frame. So the example I've been using for this, my mother, when she was in home health, her PCP certified her for home health, but she was also under a oncologist and a cardiologist during that time. And the PCP allowed the home health agency to also accept orders from those two physicians. Any of those physicians could provide the face-to-face encounter if this regulation is finalized as proposed in the face-to-face encounter portion. In addition, we have been begging for changes to the HHCAHPS survey for years, and this proposed rule does propose to implement a lot of changes to the HHCAHPS survey. In addition, many of you who are also involved in hospice know that the hospice CAHPS survey was updated for 2026 to include an email version of the hospice CAHPS survey. The home health CAHPS survey in the proposed rule stated that they had been testing the email version of the HHCAHPS, but it did not state in the proposed rule as to whether or not it was part of the proposal that we be allowed to submit HHCAHPS via email version. So in your comments, please include that we definitely want the ability to be able to send the HHCAHPS surveys through email. Obviously, the most important factor in your comments must include the proposed payment cuts and, again, how they are going to impact your patients' access to care and your ability to provide care at all. I am going to provide links in this Monday Minute to some templates that the National Alliance for Care at Home has put together and is providing nationwide to assist agencies in effectively commenting on this proposed rule. There will also be a webinar that is conducted by the National Alliance for Care at Home on August 7th. We will also provide the link for you to be able to register for that webinar as well. We are very upset, honestly, and frustrated with the content of this proposed rule when it comes to the proposed cuts, especially, and do hope to encourage anyone that gets this information to comment on that proposed rule. There is definitely power in numbers, and they need to hear from you as individual agencies. Thank you so much for listening today. If HPS can help in any way, please don't hesitate to reach out. Have a wonderful rest of your week.